Hello and welcome to CHD Wise, an education series for patients and families. My name is Becca Kalivas and I am the Education Director at Conquering CHD. This event is being recorded live and the recording will be stored at conqueringchd.org. In today's episode, we welcome panelists from Nemours Children's Health and the Conquering CHD Delaware chapter as we explore promoting mental health for children with CHD and their families. Our moderator is Dr. Gul Dadlani. Dr. Dadlani is Chief of Pediatric Cardiology at Nemours Children's Hospital in Florida. He is certified by the American Board of Pediatrics with a subspecialty certification in pediatric cardiology, and he has special interests in pulmonary hypertension, congenital heart defects, heart failure, and Williams syndrome. Welcome, everyone, and thank you for joining us. Before I turn things over to Dr. Dadlani, a few housekeeping notes. Following the presentation, we will be answering questions you submitted during the Q&A function at the bottom of your screen. If we do not cover your questions during that time, or if you have follow-up questions to a topic being discussed, we will make note of the questions asked and follow up as possible after the webinar. Our panelists will not address questions specific to your medical diagnosis, but will speak in generalities and provide relevant resources for families to learn more. As always, with the information learned, we encourage patients and families to discuss their specific concerns directly with their care team. With that, I will hand it off to Dr. Dadlani.
Becca, thank you so much for having us tonight. We're honored and privileged to be here. Thank you for all the parents and patients out there for joining us tonight for Conquering CHD and Nemours Children's Health webinar. My name is Gul Dadlani, and I'm the Chief of Pediatric Cardiology for Nemours in Florida. Nemours Cardiac Center consists of highly trained pediatric specialists and surgeons throughout the states of Florida and Delaware. Together, we come together for one purpose, which is to improve the lives of children with heart issues. For myself personally, I got into cardiology because I had a sister that was born with congenital heart disease and had surgery in 1980. As a health system, we perform highly complex cardiac procedures and surgeries. Yet what our patients and families remark most about the care that they receive is the way that we help them through their healthcare journey. As medical professionals, we treat hearts, but more importantly, we care about the child that they beat within. Because Nemours Children's Health System, we go well beyond medicine. I'm incredibly proud of the partnership that we have with Conquering CHD and Nemours. By working together, we've been able to serve patients and families on a local and national level since 2018. We're honored to support Conquering CHD's patient advocacy efforts and all that they do for patients and families across the United States. Two of our senior leaders, Dr. Erica Sood and Dr. Peter Weirden, have personally been involved with Conquering CHD and serve on their scientific advisory board. This provides an opportunity to work and inform on research activities and educational resources. We are proud to have the honor tonight to introduce my friend and colleague, Dr. Erica Sood, and our patient and parent panelists for this evening. First off, Dr. Erica Sood is a pediatric psychologist at Nemours Children's Hospital in Delaware, and she's the director of Nemours Cardiac Learning and Early Development Program. Her clinical care and research focus on promoting child mental health and neurodevelopmental wellness. Dr. Sood is the immediate past chair of the Cardiac Neurodevelopmental Outcome Collaborative and a member of Conquering CHD's Scientific Advisory Committee. In addition, tonight, we're honored to be joined by our parent panelists. First off is Danielle Wagner. She's a heart mom to Lacey, who's age 7, and her 2 sisters. Over the past 10 years, she's had teaching experience in the special education field. She is currently the president of Conquering CHD for the state of Delaware. In addition, we also welcome Erin Regal. She's the proud parent of a soon-to-be 13-year-old heart warrior named RJ and 2 heart-healthy children, at ages 9 and 6. Her professional background is as a scientist, developmental program manager for a pediatric health system. She currently serves as the vice president of Conquering CHD for the state of Delaware. So tonight, I'm honored to turn the program over to Dr. Erica Sood. So thank you all for joining us.
Thank you very much. So I'm excited today to talk about promoting mental health for children with CHD and their families. I'm going to start with a broad overview of different aspects of mental health and common concerns. I'm going to talk about how CHD can affect the mental health of children with CHD and how CHD can affect the mental health for children with CHD and their families. I'll talk about tips for promoting mental health and then finish up with some supports and resources that are available. Next slide. I often hear from parents that it's never just the heart, as if that wasn't enough on its own. And it's true that children with CHD can sometimes experience complications even once the heart is repaired or palliated. Next slide. Today, we're going to be talking about an incredibly common, important, and unfortunately under-recognized and undertreated complication of CHD. Next slide. When we talk about mental health, we're talking about 3 domains. We're talking about what we're thinking, how we're feeling, and how we're behaving. So mental health professionals often consider these 3 domains in considering whether an individual, a child, or potentially a parent is experiencing mental health concerns. Next slide. Someone who is experiencing mental health challenges may often think, it's all my fault, I'll never get through this, or they may ask a lot of what-if questions, potentially staying up late at night thinking about those questions. They might feel anxious or overwhelmed, or maybe acting irritable. And in terms of behaviors, they may avoid reminders of events that were traumatic or stressful. They may isolate from family and friends, and they may find themselves lashing out at people that they're close to. Next slide. Of course, mental health concerns are on a spectrum, and some of those thoughts, feelings, and behaviors that I mentioned are normal and expected reactions to stressful events. Typically, those go away over time. They don't cause significant distress or interference. Other times, mental health concerns would be in what we would call the at-risk category, which basically means that there's more concerns than we might expect to see at a particular age or developmental stage or given a situation, but it's not at the level where it's causing significant distress or interference, and we just want to keep an eye on it and potentially implement some proactive preventative interventions. And then there are times where mental health concerns can reach the level of a diagnosis, and this means that those concerns are causing significant interference, significant distress, and are well beyond what we would expect for a person's age, developmental stage, or situation. So for example, someone who's experiencing intense anxiety and may meet criteria for an anxiety diagnosis, may avoid social situations, may not want to separate from their parents to go to school or a friend's house. Someone who's experiencing post-traumatic stress disorder may experience intrusive thoughts related to a traumatic event, may experience hypervigilance, or hyperarousal anytime that they are exposed to reminders of that event. Next slide. Unfortunately, mental health concerns are common in children with CHD and their family members. So children and adolescents with CHD have higher rates of anxiety, depression, behavioral problems, and ADHD. And in one study published in Pediatrics recently, the investigators found that rates of these challenges were about 5 to 7 times higher in children with CHD as compared to children without CHD. We also know that 25% or more of children and adolescents with complex forms of CHD have some type of PTSD symptom. That doesn't mean they meet full criteria, but they may experience some intrusive thoughts, or they might have some avoidant behaviors related to experiences that they have perceived as traumatic. And about 30% of parents of children with CHD have clinically significant mental health challenges at really any point in time that is measured by research studies. So most research studies of parents are what we call cross-sectional. What that means is that they're measuring anxiety or depression or traumatic stress at just one point in time. That may be at the time of prenatal diagnosis, that may be at the time of hospitalization or at hospital discharge. But across studies, we do find that the percentage who are experiencing distress is about 30%, which suggests that the rate over the lifetime may be much higher. Next slide. So why would we see this increased risk? For children with CHD, they're exposed to medical experiences that can be scary or even traumatic. And sometimes those are unpredictable and really not within their control. Children with CHD are at higher risk for challenges with development and learning. And we know that neurodevelopmental challenges can also place children at higher risk for mental health problems. Children with developmental and learning problems know that they're a little bit different. School's just a little bit harder for them. Sometimes social relationships are a little bit harder for them. And so sometimes we also see higher rates of anxiety and depression. Children with CHD can also have difficulties regulating emotions and behaviors, and this goes along with the challenges with development. But when you have a hard time regulating your emotions, if you have big emotions and you have a hard time managing them, we sometimes see that you also have a hard time managing anxiety and depression and anger, and that can lead to more significant mental health challenges. Children with CHD are more often to miss school and social opportunities due to their illness, and sometimes they feel different from their peers. Next slide. So why are parents and caregivers at increased risk? Well, we know that parents and caregivers unfortunately experience traumatic experiences related to their child's CHD. And these experiences can be chronic in nature. So when a parent is told that their child has a CHD, they're also told your child will have this condition for the rest of their life. They'll need to follow with cardiology for the rest of their life, and they may need additional surgeries. And so parents are often waiting for that other shoe to drop, and it's hard to really focus on themselves. I often hear parents say, I just need to get through this next surgery, or I just need to get through this next procedure. Similar to what I said about kids, the CHD and related medical experiences are often unpredictable and not within their control. And parents can experience day-to-day parenting stress. And when I say parenting stress, I really mean all of the daily tasks that have to be done. So feeding, managing feeding supplies if a child has a feeding tube, financial stress, multiple appointments, missing work, caring for a medically complex child. All of this, maybe on its own wouldn't cause mental health challenges, but you put it all together day to day, and sometimes it can result in increased levels of anxiety or depression. And then lastly, strain on relationships. And this sometimes can cause people to feel isolated from their friends, family, and partners. Next slide. We don't know as much about siblings. Studies that have looked at siblings, they've been few and far between, but we do know that CHD can affect family dynamics, and siblings are in that family too. And sometimes there's increased focus, as there should be, on the child with CHD, but that can mean that sometimes siblings are having to adjust to that change in family dynamic. Siblings worry too, and they may worry about their sibling with CHD or sometimes about their parents. Siblings experience separation from their parents during hospitalization, and they're usually resilient, but still that can have an effect for some kids. And siblings, as they get older particularly, sometimes try not to add stress for a family that's already under a high level of stress, and therefore don't always talk about some of the challenges that they're having. Next slide. So, why are we so focused on parents and parent mental health? Parents are often most focused on their child, and they say, no, I don't want to focus on myself. But we know that parent mental health is related to child mental health. And mental health in parents can affect parenting style, which then of course can affect kids. So parents who've experienced a trauma, sometimes related to their child's care, can sometimes parent in a more overprotective way, which makes a lot of sense, but unfortunately doesn't give kids the same opportunities to develop autonomy and have opportunities for socialization. Sometimes parents who are experiencing stress or anxiety can have challenges setting limits for their children. It can be difficult to be present in the moment with your child, and sometimes parents can have reduced patience. All of this makes perfect sense, but it can over time affect the way that a child is parented. And mental health can also affect family relationships, and children with CHD and their siblings are within the family. It's where they spend most of their time. And so we want to make sure that family relationships are as healthy as possible. Next slide. So I'm going to share some tips for promoting mental health. Before I do this, I want to just emphasize that every family is different. You know your child best, and you know your family best. And so think about which resources may work best for your family. Next slide. So first, normalize the emotional impact of CHD. I want to emphasize it is normal for CHD to affect how people think and feel. That is expected. We don't talk about it much, but it's true. When you're talking within your family, to your partner, to your kids, normalize the emotional aspects of CHD and ask open-ended questions. I often normalize first and then ask, because I think people are more willing to share when they know that what they're feeling is normal. So I might say, most kids feel kind of down and depressed at times, when they're experiencing, whatever it is the child's experiencing. How about you? Or what's that been like for you? Rather than asking a yes or no question. Do you feel depressed? Well, probably the right answer there is no. And so I ask an open-ended question in a way that assumes that the person has felt that way. And they can always correct me if that's not correct. But in most cases, we're normalizing very, very common emotions and common reactions that most people do relate to. Seek mental health support proactively. Don't wait until it's a crisis. And that's really part of normalizing the emotional impact of CHD. If we think that, everybody who has CHD and their family members are going to have some emotional impact, then we need to be providing and helping families to access mental health support, from a really early point, so that they have that relationship in place for when things do come up. And then share your story. That can be therapeutic in itself, but it also, if everybody shares their story with mental health, with the emotional impact of CHD, then new families coming into the community realize, hey, this is a safe community to talk about this. There's not stigma about this in this community, and I can share my story too, and I know it's normal. Next slide. Seek support. So, there are different types of support, and most types of support don't involve professional mental health supports. So peer-to-peer support. So accessing support through your Conquering CHD state chapters, through Facebook groups, online supports, whatever works for you, and whatever works for your child. Access support within your community. So this may be support of friends or family, community members, religious leaders. Help yourself by helping others. We know that people who help others and give back often do find that to be very therapeutic, and it can actually have a benefit on their own mental health. And also through doing that, they realize that they're not alone. And there's other resources like Heart Camp, CHD events. These can be helpful not only for children with CHD, but sometimes also their siblings and their parents. Next slide. Recognize signs and symptoms of mental health challenges. I'm not going to go through each sign and symptom as part of this presentation, but I do want to provide some resources as to where you can read more. So Nemours Kids Health is a wonderful resource. They have sites for parents and for kids, and goes through, there's an emotional and behavioral section that goes through a variety of different emotional challenges that kids might experience and a variety of different behavioral challenges. And like I said, there's content for parents as well as for kids. Nemours Kids Cope is a separate site that is through behavioral health that has some additional resources on behavioral health conditions specifically. There's a site called effectivechildtherapy.org, and this is one of the divisions that, through the American Psychological Association focused on child mental health. And this is a wonderful resource. Even if your child is not having any mental health challenges, I suggest you check it out just to know what's there. So they have a whole part of their website dedicated to kind of signs and symptoms of different mental health challenges and what might that mean, and what is a cause for concern. And then I'll talk a little bit about some of the other resources they have on that site as well later. Worrywisekids.org is a site focused specifically on anxiety and worry for children who are experiencing those types of challenges. There's a connected with effectivechildtherapy.org, you can actually get into a free assessment center that provides online assessment. Either you fill out based on your symptoms or what you're experiencing, your child can fill it out, you can fill it out for your child, and it'll provide results and recommendations based on what you filled out. Now, of course, this is not the same as having a professional mental health evaluation, but it's a good first start as to whether to know, hey, is this something that I should be concerned about? There are many resources on the Conquering CHD website relating to mental health. Cheryl Brosig, who's a psychologist in Wisconsin, and myself created a document a few years back called Promoting Mental Health for Parents of Children with Cardiac Conditions, and that's on the Conquering CHD site. And that goes through specific kind of signs and symptoms of anxiety, depression, and post-traumatic stress, and what you might see specifically for parents of children with cardiac conditions. Next slide. Talk to your doctors and nurses. And this includes the primary care doctor, this includes a cardiologist. I think parents and patients often feel like, I don't really want people to know that I'm struggling, or it doesn't really seem like the appropriate person to talk to about this. But we do know that emotional health is related to cardiac health, right? We know that children with congenital heart disease and their families are higher risk for mental health challenges. And so it is appropriate to talk with them about it, and they won't know unless you tell them. They may have recommendations for who to talk to. They may have recommendations for a psychologist or social worker within the center or within your primary care office. And even if they don't, having parents and patients talk to them will, I think, over time will help them to realize that, these resources are needed for their patients, and they will then become advocates for ensuring that those resources can become available within the center if they're not already. Asked to meet with a social worker or psychologist. Like I said, there's many primary care offices, many cardiology practices now have social workers, and in some cases psychologists as well. Schedule an appointment with the cardiac neurodevelopment team. Many cardiac centers have a cardiac developmental follow-up program as part of care. You may think, well, that's neurodevelopment. That's different than mental health. My child's not having any problems with development. Most of the evaluations are done by psychologists who have expertise working with children with congenital heart disease and their families, and can evaluate mental health along with neurodevelopment, and can provide recommendations for additional support. There are a number of cardiac neurodevelopment programs in the country, probably about 45 or 50 at this point. You can go on the CNOC website, the Cardiac Neurodevelopmental Outcome Collaborative. The website is right here, and there's a list of institutions that are members of CNOC and that have cardiac neurodevelopmental programs. You can check and see if your care center's on there. If they're not, ask your cardiologist about it. And some sites will also see patients that are close by that are not followed in their center. Next slide. So how do you access mental health evaluation or treatment? This is getting harder and harder. First, learn about evidence-based therapies. Not all therapies have been shown to work, and that's really important, especially for kids. Not all therapists are skilled with working with children. EffectiveChildTherapy.org, I know I've mentioned this multiple times before, they have a whole part of their site on what are evidence-based therapies, what do they look like, what are they called, what conditions do they treat. And this is really important because just like you had to be an advocate for your child in the hospital with regard to their cardiac care, you also have to be an advocate for your child with regard to mental health care. And you want to make sure that if you're going to take the time and the resources to access mental health therapy, that you're going to a therapist who is skilled at treating children for that specific condition, and that they provide evidence-based therapies, meaning that they have been shown to work in research studies. Learn about services offered through your child's care center. Again, many hospitals do have social workers in their cardiac center. I would say the vast majority, if not all, and many do have psychologists embedded within the cardiac center as well. Not all, but I think that number is growing every year. Call the insurance company for a list of providers. That is the best way to find out exactly who is covered by your insurance plan. It can be challenging because, especially in this day and age, there's definitely a shortage of mental health providers and a lot of need. And so some providers aren't taking new patients, or they have long wait lists. So I'm going to give you some other options as well. But wherever you go, ask about telehealth options. If your care center has a psychologist who can work with your child or you, but they're 3 hours away, ask about telehealth. They may be able to see your child through telehealth, and maybe you go in periodically in person. Next slide. Given how hard it is to access mental health treatment at this point, I wanted to just provide a couple other options that you may not know about. So many universities have psychology training programs, and these are doctoral programs. People are very highly trained with psychologists in training who are practicing within their university clinic. Many of those clinics are open to the community. So if you have a local university and you're looking for mental health care and you're not able to access it, call the university, check and see if they have a psychology training program, and see if they have a clinic that does take patients through the community. Those typically have very low fees or a sliding scale fee. Many employers do have employee assistance programs. Oh, it looks like we switched out of our slides here. There we go. Many employers do have employee assistance programs, and this is a program that will pay for a certain number of mental health appointments. So therapy, for example, for the employee or their family members. Typically, it's a small number, 4 sessions, let's say, but they have somebody contracted to provide that, and that person can then give you guidance as to where to go next if it seems important to have another, ongoing therapy after that. I would also consider clinical research studies that are focused on mental health interventions. It depends on the study in terms of how established the treatment is, but in many cases, these are treatments that have been shown to be evidence-based or to work in other populations like the general population, and now they're being tested, let's say, on children with CHD. Does this mental health treatment work in children with CHD, just like we would expect in children without CHD? Or they may be adapted from existing mental health interventions. So, just good to ask about all your options, and if that's something that you'd be interested in and that is available, read the consent form, talk to the study team, and determine whether that would be an option for your family. Online resources. There are many resources that are quite helpful for parents with regard to learning skills, understanding child behaviors and child challenges, and in some cases, even having your child go through an online program as well. So the Triple P Positive Parenting Program is available to parents. I believe there is a cost associated with, but I don't think it's too expensive. And it is focused on helping parents understand how to manage challenging behaviors in their children. And these are all evidence-based programs, meaning that they have been shown with research studies to work to help kids and their families. The Incredible Years is another program, and that's focused on younger children with behavioral challenges. There are groups, I don't know how they're doing this during COVID, but there are groups that are in all different locations around the United States where parents come together and and learn strategies to manage behaviors for their young children. And there might be virtual options at this point. Child Anxiety Tales, this is a great resource. This is an online parent training program for managing anxiety in children. And it's available, it's fully remote. Camp Copilot is a program that is geared towards the kids themselves. So the kids actually go through the program themselves. And then there's a resource called healthcaretoolbox.org. This is focused specifically on pediatric medical traumatic stress. So what that means is traumatic stress that has resulted from pediatric illness or injury, but it's focused on the children themselves, parents, family members, and actually healthcare providers also. And there's a number of resources for patients and families about medical traumatic stress. Definitely something to check out. Next slide. And then once you do find a therapist, establish an ongoing relationship. So consider periodic check-ins or booster sessions, even when there's no major concerns. I think people are often, eager to say, oh, no, we're good, we're done. And really, I would say, if you have a child with CHD, whether it's for yourself or whether it's for your child, there's going to be new things that come up along the way. So keep that relationship going. See if you can check in once a month, quarterly, once a year, just so that you know who to call when things come up, and you can be proactive rather than reactive. Again, it can be hard to access mental health services at the time when you really, really, really need them. So start early so that you have that in place for when you need it. Use mental health supports in a proactive and preventative manner. Just, in general, that's what I would recommend. Next slide. So, my vision for the future of mental health in CHD is that all children with CHD and their family members have access to mental health services. And this includes both preventative services as well as treatment. And that every pediatric cardiac center has dedicated mental health professionals, ideally more than one, who are there to work with families to prevent mental health challenges, to address at-risk challenges, and to intervene upon clinically significant diagnoses. Share your story. Talk to your care team. Parents and patients have, you have a lot of power with your stories and with your relationships with your teams. And let your care team know that this is important and this is something that you and other families need. And let's break through the stigma of mental health, in this community. And let's work together to make this happen. Thank you very much.
And thank her and go into the questions.
Erica, great presentation. Thank you very much.
Thanks.
We'll open up for questions. So for all the parents and patients out there, if you have questions, please put them in the chat box. I'll be happy to present them to our panelists. To start off tonight, for all of our panelists, one question that comes up is, should every CHD patient have routine mental health screening? And one of the parents asked, Dr. Sood, could you elaborate on how you would recommend a parent screen for depression with that? And I know, Erin, you have a teenager at home. So I don't know if you want to go first, Erin, and then we'll open it up to the rest of the panel.
So I do think that it is helpful to have every child connected with somebody. So whether that screening is done early or in different intervals, I think it's important because, as Erica mentioned, when you actually need that support, it's sometimes hard to get in at that moment. And as we parents know, we want to fix the problem right now. We don't want to wait to see a provider in 3 months. So if we start that connection in the screening early, we'll know what to look for, what signs, and we'll already have the relationship established. So I do think it's a valuable idea.
Thank you. And Erica, how would you recommend a parent talk to their child about mental health issues from a screening standpoint? Is there a certain sentence or couple sentences that you would use on a regular basis to kind of within that, when you're having dinner at the dinner table, to ask their child, are you feeling any stress or any issues with depression or other things?
Yeah, I mean, I think, I don't know that I would do it at the dinner table necessarily. I think the dinner table is probably for those broader questions of, what's going on at school and how are things going. But I think, there's a time and a place for just that, like I mentioned, the normalizing and the asking open-ended questions. So I never ask an open-ended question without normalizing first. I think that's really, really important, especially for kids. So to say, and maybe you can talk, Dr. So-and-so, whoever their doctor said that it's actually like most kids feel this way, or a lot of kids feel anxious when they have a heart condition, or might feel worried about their heart. What about you? Or how's that been for you? And that way they know that like what they're about to say is really normal. And they feel more comfortable saying it. So that's how I typically ask those questions. And it could be whatever. I mean, I think it's important to ask about anxiety. It's important to ask about worries. It's important to ask about depression. I think parents usually have a pretty good sense of their child. And so there's probably some behavioral signs if your child is experiencing significant anxiety or depression that you're going to notice as a parent. I think it's often more, well, how do I know if I should be concerned about this? Is this normal? Is this what every kid's like, especially as you get into those teen years? And that's when I would actually go to that assessment center that I mentioned. And I know that these links that I provided are all going to be shared, I think, in an upcoming blog from Conquering CHD. But if you go to effectivechildtherapy.org, there's a link to an assessment center. And there you can actually go to like actual mental health assessments that, again, this is not the same as being evaluated by a mental professional, but it's something you can do at home and just kind of just look and say, like, this is what I think my child is experiencing. They have parent report questionnaires as well, and see what comes up. They'll give you the results. They'll give you some recommendations. I think it's, if you can touch base with a mental health professional on an annual basis, I think that's great. Even if it's not annual, through our developmental follow-up program, as kids get older, if things are going well, we only meet every 3 years, but we tell the families, like, contact us with any concerns or questions. These are the things to look out for. If there's anything that's sort of falling in that at-risk range, these are the exact signs I would look for. And if you see these things, contact me. And so that way you have a point of contact, and parents will call before they're due for their next developmental follow-up appointment and say, like, I saw this thing, should I be concerned? So I think it's most important just to have that point of contact as somebody you can contact if you have questions or concerns.
Thank you very much for elaborating on that. I appreciate it. And I know from both my own family and from taking care of families that have children with congenital heart disease, as a parent, when you first hear the news, my baby has congenital heart disease, whether it's in the womb or right after birth, that can be a very overwhelming feeling. So I guess for Danielle and Aaron, how was that in your personal experience? And when you look backwards on that, now that you're, years after going through that, a first initial experience with that, what would you recommend for the other mothers and fathers that are newly diagnosed that are on this call?
Danny, you want to go first?
Sure. Aaron and I have had many conversations about this, and it's pretty much a blur. So if you're in that phase right now, just know that if everything is a blur to you, like, that's completely normal. We found out after Lacey was born, and she was 7 days old. And, I just didn't know. I didn't know anything. And it was very overwhelming. And so I just want parents to know that that's okay. It's okay to be overwhelmed. It's okay to, not understand everything that's going on around you at that time. And, that there are resources available. I love the peer-to-peer support that is offered through Conquering CHD as a way to help parents get through that. And just know that you're not alone, that there's help out there. So.
Thank you. Aaron, did you want to add?
Aaron, I think you're muted, or we can't hear you. We can't hear you.
Yes, critical aortic stenosis. And, oh, sorry guys, my connection's not stable. So if you can't hear me, I apologize, but I just remember it becoming quickly an out-of-body experience. And I look back now, and to me, it's like I can watch myself go through the things, but it's definitely an out-of-body experience. Since then, I've done a lot of peer-to-peer support, and what I would tell every mom who's newly diagnosed, it is not your fault. And I think that is very important for moms to hear. It is not something you did that caused this, because immediately us moms turn to, this is our fault. We did this. We must have done something during the pregnancy, and that is not true. And I think that's important for parents to understand, and to start to normalize the situation and give them, most importantly, hope that their child is going to have a future. It may not look like what you thought it would look like, but they will have every chance to have so many great opportunities. And I think that's something we have to hear early, and we have to hear often.
Thank you. Eric, anything to add on that one?
No, I think Aaron and Danny put it very well. I have nothing to add.
Fantastic. So as we look at the spectrum of life, we know that congenital heart disease exists within the full spectrum of life, whether you're a fetus in the womb, whether you're an infant, whether you're a child, whether you're a teenager, whether you're an adult with congenital heart disease. So that diagnosis never goes away. We do many surgical procedures to palliate or make that better, but they always need long-term follow-up for most forms of congenital heart disease. So we had an interesting question from the audience. They said, my son wakes up randomly at night. Do you think this is a mental health issue? And I know that children at different stages, especially young children, will go through different stresses and anxieties just because of childhood. But then you compound it with congenital heart disease on top. And as parents of children who have gone through at 7 and 13, some of these developmental stages, what advice would you give this mother?
Yeah, and without knowing the age and the stage, I think what I would say is that I think it can be really hard to figure out what's just like a normal developmental stage and what's CHD. But I think that, while kids without CHD can also have sleep challenges and can also wake up in the middle of the night, I think there are a number of things that make that a little bit more difficult for kids with CHD. So if they've spent time in the hospital recently, they can get totally out of whack in their sleep schedule, and they're going to bed late, and the nurse is coming in at all hours of the night. And, if they're on, Lasix and they're having to get up and go to the bathroom, multiple times during the night, or if, sleep has always been a more challenging thing for them because maybe they never developed good sleep habits early on because they were spending time in and out of the hospital, or because, they, it might have been harder to develop good sleep habits when you have a baby who was just, really sick. So I think there's a variety of reasons why that could be happening, but I do think that there are certainly stressors that can exacerbate it for children with CHD. And for that, I would say there are great sleep books on kind of managing sleep challenges in kids. There's also people who specialize in sleep. I would, if this is something that's really causing problems and is a concern, I think this is a reason to go see a behavioral health or a mental health provider who, again, specializes in kids. You've got to see someone who specializes in kids, because I think adult psychologists aren't going to really know what to do with this. But it can be kind of just even a habit, like a behavioral habit, or it could be anxiety related. So there's a variety of reasons. I think if it's really causing problems, I think it would be a good idea to try to find somebody potentially through your care center who could help.
Thank you. And for Danielle and Aaron, I don't know if your children had any sleep issues as they were going through the different stages, from toddler to older children.
Yeah, absolutely. I know I used to dread coming home from the hospital because nothing was normal. His schedule was all over the place, and he was terrified at night, and it just took so long to get back to your normal sleep schedule. And then I swear the turnaround, once you get normal, it's like another admission for something else, and you start it all over. And as I said, my son's soon to be 13, and he's still, because he's on quite a few diuretics, he's up 2-3 times a night using the restroom. This morning I woke up and he was in bed with his brother and the dog. So it hasn't stopped for us, but for us, he just does it just because. There's no rhyme, there's no reason. That's just something he's always done. So I think it's knowing and understanding your kid. And if you have that red flag where you think maybe this isn't normal, or maybe this is a problem, or reach out, talk to somebody, ask a question. Don't be afraid to ask a question.
Excellent.
Yeah, Lacey was the same. She did not sleep through the night. I have 3 children, and she was the only one. She didn't sleep through the night till she was like 19 months old. I was like, what is wrong with this child? But we were in and out of the hospital so much during her first year that that was part of it. Just their schedules were all out of whack. And even now, she's not on medicine anymore, but she still gets up in the middle of the night, and she still is just a very light sleeper. She's up really early. She's one of the last ones to go to bed. And so she just has very different sleep cycle than her sisters. And it's just, learning who she is, like Aaron said, and just following that. Now, if something's way off track, then I agree, reach out to someone and get some professional help. But just kind of learning as they go what is working for them has been helpful.
Thank you. Now, as we can continue along the spectrum of life here with our questions, we had another great question come in from our audience. So this is, if my child or teenager needed mental health counseling, how do I convince them to go to and agree to therapy? Because that can always be a challenge. One, we may identify a problem, but 2, how do we get a patient that's going to engage with their therapist to really tackle this issue and make an improvement in our quality of life? So we'll open this one up to the panel. So I don't know, Erica, if you want to go first.
Yeah, I would say 2 things about this. So this is common. I think that most teenagers, not all, but most teenagers, and especially boys, I think are going to fight going to a mental health professional or, a psychologist to talk. I will say there have been times where, we just say, okay, well, let's agree to go 2 times or 1 time or 3 times or whatever it is. Like, we're just agreeing to go a couple times. And that's the agreement. And maybe they get something for it. I don't know. But generally, I think as long as you find somebody that's a good match, they'll agree to go back. Because I think in the end, they think that's this scary thing, but once they go, it's just somebody who's actually listening to them and hearing their perspective, and in some cases being an advocate, and I think oftentimes, especially when I'm working with teenagers, I do a lot of sort of moderating between the parent and the child and helping the parent to understand the child's perspective. And so they do start to see you as an advocate. And so I think that would be the approach that I would typically take, is just tell them that you were just going once or twice, you can decide, we'll see how it goes. If unless you feel like it's a real crisis, and then they've just got to go. The other thing that I have experienced, and and I've been in our cardiac center for 11 years, so I've gotten a chance to work with people for a long time. And what I have seen is that sometimes usually moms will drag and this is usually boys, will drag their boys in at like 11 or 12 or 13 and be like, he really needs it, like there's something wrong. And it doesn't really go anywhere, and you're just like trying, but it's not really like going anywhere. And it's just because developmentally they're just not ready. And then I usually get a call like 5 years later, and that teenage boy is not asking to meet with me because developmentally they're ready. And then it all comes out, right? And they're like totally engaged. And so I think that the other thing is just, sometimes it just helps establish a relationship with somebody. And even if you don't use it a lot at first, they now know that it's not scary to go to see a mental health professional. They know who they would see if they were to see somebody. And then when they feel like they need it and they're ready, they can then ask to see that person and know who they're going to see. And again, it's easy to get back in, and it's not scary. So that might have been just specific to my situation because I've been in our cardiac center for so long and I have the ability to do that. And that may not apply to every mental health professional, but I think that we also have to think about where a child is developmentally, and they sometimes just aren't ready.
Excellent. And how about Erin?
I would just add that, our kids, we have to be careful and try and understand where they're coming from, because, so much they hear things like, you have to take your medicine, you have to go to the cardiologist, you have to have surgery, you are going to be in pain, right? So we don't give them choices on a lot of things. So if we understand what the hesitation is, if we have that open conversation with our kids, like, why don't you want to see somebody talk about this? There's a lot of kids who are doing this, and it's, there's going to be no needles, is something we would say in our house, or no pain involved, and try and understand their frame of mind, because sometimes it's just another doctor, another appointment, another missed play date, whatever that looks like. So it's important for us to get into their frame of mind and understand where their hesitations are. And then, like Erica says, I go with the negotiation. Let's try it 2 times, see what happens, see if you like it. If you don't like it, we'll try something else. But at least you can get them in the door. And I think sometimes that's just the first step, is hearing their thoughts and then getting them in the door, and then go from there.
Fantastic. So we've had a couple other questions come in as well. And we know that as children go through their developmental process, there's different stressors along the way. But let's go back and focus on the parents here for a second. And for Danielle and Erin, we'd love to get your perspective on this. As a parent, whether you're a mother or father of a child with congenital heart disease, as they go through surgery and they go through all their follow-ups, how do you get your mental health break or little vacation, respite? Where do you find your little island of reprieve from all the craziness that healthcare brings to your child?
Annie, I'm kicking that one to you first.
Thanks, Erin.
That's a hard one.
That is hard. I remember when we were in the hospital when Lacey was very, very little, I would just go for walks. She has a twin sister, and so baby Kay and I would just take off and just go walk the grounds and just kind of get out of the hospital and like clear my head, get some fresh air. It's just a lot, and then walks, because you're trying to learn so much. You're trying to be there for rounds. You're trying to keep track of appointments and learn who all these doctors are and what their roles are and what they're doing for your child. And it's a lot. And so for me, it was just, okay, I need to get out of this space for a few minutes. And I always had mom guilt, even leaving her, knowing she was perfectly fine in her isolate. But for me, it was what I needed to be able to process everything and be able to come back and be a responsible caregiver, which is what I wanted to do for her. So I know it's hard to leave, and I know moms don't like to leave. I hated leaving her, but there was just times when I had to get out and get some fresh air. And so I would just take a walk. Very simple, but that's what I have for now.
Fantastic. Thank you for sharing your personal experience. Erin, did you want to add to that?
I would just say that I was terrible at this, so that's why I made Danny go first. But honestly, for me, what was therapeutic for me was being able to do mom things. So a lot of times at first, your child is hooked up to tubes, you're not feeding them, you're not holding them, you can't change diapers. So for me, the therapeutic was all of a sudden, I could change diapers, or maybe now I could hold them for a little bit. And that was kind of the release and relief I need. I also back in the day, because again, my son's about to be 13, there was Care Pages. I think there's Caring Bridge now. Writing, I wrote every single day. And that was really my therapy and release, because again, it felt like an out of body experience, and I didn't want to forget everything that happened. And I wanted RJ to have a way to go back and see what we went through as a family. And so for me, that was therapy. And I'll just add now that if we were in the hospital now, I would be calling the pet therapy program like every 5 minutes. Get that dog in this room. That would be all I would need.
That's
That
awesome.
would be my, so.
Erica, any advice you would add for parents that are going through having a child in the ICU for making sure they take a mental break?
Yeah, I mean, I think that I think it looks different for everybody, right? And so, when people hear self-care, they think it's something that they couldn't possibly do while their baby's in the hospital. But I do think that it's often just get out of the room for a brief period of time so that you're not within the same like 4 walls for, 4 weeks straight. Go get a cup of coffee, go, whatever it is for you, it's important to do it. And there has to be some way to recharge, or else you're running on empty.
Excellent. Well, one other question we got in as well is if we think of our children with cardiac disease as, from a parent perspective, many times we like to put them in a bubble and protect them and watch them in this protected environment for as long as we possibly can. So to the panel, how do we break the bubble, right? Because all of our children grow up, and as they get to different milestones, we have to let go as parents. And that can be as mentally stressful as the child in the ICU. The first time they get on a soccer field or baseball field, or the first time they have a first of any accomplishment. How do we, as parents, kind of let go of our child with a chronic disease process to just be more independent? So I don't know if Erin or Danielle, you could give an example from your own child at their particular age group of how we kind of broke the bubble for your child to be able to go and do a first in their life.
Honestly, for me, I think I was the opposite. Sometimes I think Erica mentioned that we try and put our kids in a bubble, and we were the opposite. We wanted our kid to have every opportunity at a normal life. So the first shot that he could play soccer, we put him on the soccer field. The first shot that he could play baseball, he was on the baseball field. He was skiing down the mountain at 5 years old. So we were a little bit different. What I found was hard was the first day of kindergarten, because all of a sudden daycare was in my place of employment. Kindergarten was a different place, and I had to trust someone else to give medications throughout the day. So that was a little more unique. But for me, I think for parents, it is very hard to step back and let your child do these things. But when you do that and you do it freely, the joy on your kid's face, I'm telling you, it's so worth it, just to give them those opportunities and let them grow every chance that they have, because that's what they want. They just want every shot to be a normal kid, not just a hard kid, just a normal kid on the playing field, in the school, on the recess grounds, whatever that looks like. So do your best to just step back, even if it's a small thing such as taking a couple extra feet away when they're on the monkey bars, whatever that looks like. Just give them that chance to try and see who they are.
I agree with Erin. We were kind of the opposite too. And I think Lacey helped us with that, because she was like, from the beginning, she's like, no, like, I got this, like, I don't need you. So she kind of forced us out of the bubble. She's the youngest, she's the second twin. She's the youngest of 3. And she was trying to keep up with her sisters all the time. And she was a late talker. We went through speech and some other therapies. And I remember one of her first sentences was, no, I do this. I do this. And that's been her mentality since. And so it's been amazing to watch her overcome and to just be able to do stuff. We put her on the soccer field right away too. And gymnastics, whatever she was interested in, we encouraged her to go. And it's incredible to see them become independent and to just explode on their own. And so it's hard as a mom to step back and to let go and to let someone else, kind of take a part in their lives that we have been so much a part of for so long, but it's definitely worth it. And it's really cool to see too. So.
I found it's actually tricky to, you want to tell everyone if your kid's on the baseball field and they're pitching the championship game, you want to yell, "That's my kid. He's a heart warrior." But then you're like, no, he just wants to be a normal kid out there. But you want everyone to know what he's overcoming to do that. So I find that's the hard area more so than letting them go, is to, balance, wanting to raise your hands and high five every parent you can, and remembering that, oh, my kid would kill me if I did that. So.
And Eric, anything to add for the group?
I mean, I think I would just add that, there's also parts of normal development that aren't so fun. And those involve tantrums, right? Like if you have a 2-year-old and they're freaking out because you said no to something and they're falling on the floor, if you had a child, your other child, you may have just walked away and said, "You calm yourself down, I'm not giving in." And I think it can be harder with a child with CHD to not just be like, I'll just give them what they want because I don't want them to cry, because obviously at an early point you were likely told not to have your child cry. But I think that's equally important. It's equally important for kids to learn how to self-soothe, and it's equally important for kids to go through those typical, 2 tantrums and be allowed to work that out on their own. So I would just kind of do the flip side there. There's other ways to also not keep your kid in a bubble that are a little bit harder or a little bit less rewarding, but also important.
Thank you. And our last question tonight is, as our children transition from adolescence into adulthood, kind of a 2-part question we got going on here is, number one, as a parent, how do we kind of get them into that transition? And as a health provider, how do we make sure we find those resources for them? And I know your kids are both younger than in the teenage years. So I know that just within my own clinical practice, ensuring that the transition is smooth and talked about early on is very important for families, because I think you want to package those records and prepare children for that transition, depending on the age cutoff of your particular institution across the country, and always ensure that they transition into an adult practice that has a congenital heart disease expert in there. As you make any transition through life, obviously there's stressors with that. I was wondering, Erica, if you could just talk about making that transition and that jump a little bit.
Yeah, I mean, I think that mental health really comes into play here as well. There are higher rates of anxiety and depression in ACHD patients. And I think I'm hopeful that as we work to get the appropriate mental health supports for kids and for families, that's going to change over time. And we'll see that, that this group of patients that's growing up is not going to have as many challenges. But I think, trying to identify and address any challenges with, anxiety, depression, independence, executive functioning, which is kind of like the planning and organization piece that's so important for, transitioning to adulthood, and trying to get the right supports in place in advance of that transition would be what I would recommend.
Thank you. And for Erica, Danielle, and Aaron, thank you so much for providing us with such great insight tonight on congenital heart disease and mental health issues. I've enjoyed talking with all of you. On behalf of everyone here at Nemours, we thank all of those who have tuned in tonight. And I'll pass it back to Becca for final remarks. So thank you, Becca, for allowing us to participate.
I am amazed by the discussion tonight. It was so much helpful information for our patients and families. Thank you once again to all of our panelists for joining us this evening. A special thank you to Nemours Children's Health for partnering with us to bring this information to patients and families. For the recording of this CHD Wise episode and all of the information we've referenced tonight in the presentation, please visit us at conqueringchd.org/learn/CHD-wise/. We invite you to join us for part 2 of our mental health series with Nemours Children's Health on December 7th. Registration for that can be found on our website. For any of the resources mentioned in tonight's presentation or to take the Conquering CHD Mental Health and CHD survey, please visit our website. Until next time, good night.
Thank you.